Good morning, everyone. Bonjour tout le monde. C'est un plaisir d'être ici ce matin pour faire cette annonce importante au sujet des années. It's a pleasure to be here this morning with all of you to make an important announcement about personal care homes and the elderly in Manitoba. COVID-19 has affected every Manitoban. That is no secret. No one has been left untouched. Many sacrifices have been made. We know that in a very short space of time, we were only weeks ago closing our economy, canceling schools, sending students home from university. We were trying to move workplace activities into the home and dial into work. There was significant interruption in the way that our healthcare system worked. And we know that among those significantly impacted were personal care homes and the people who live there and the people who work there. Residents in personal care homes or long-term care facilities are perhaps among the most susceptible to COVID-19. They are the most vulnerable population. And we have seen this around the world. We have seen this in the continental U.S. We have seen this in Canada, in other provinces, that once COVID-19 enters a long-term care facility, the results can be devastating and the results can be tragic. Across Canada, approximately 80% of all deaths attributable to COVID-19 involve those living in personal care homes. And in Manitoba, we know that we are all grateful that we have avoided that kind of drastic and dire scenario because a number of precautions were taken. We started tracking COVID-19 as a potential emergency beginning in January and established a health system incident command structure already on February the 3rd. We had our first presumptive case of COVID-19 on March the 12th, and we made the tough but necessary decision to suspend visitor privileges in personal care homes right across Manitoba. And we did that on March the 17th. And many people who are watching this broadcast will remember that because it had a real and undeniable effect on residents, on their caregivers, on their families and friends who quite suddenly found themselves without that ability to go into the home and to visit that individual. At the same time, we implemented screening procedures for the staff who worked at those personal care homes. We limited the movement of staff between facilities. It was on May the 1st when we brought into effect a one worker, one personal care home condition. And we were very pleased to be able to get that done in all 127 care homes in Manitoba with the cooperation of those who operate those personal care homes. All of those steps were taken in order to prevent the tragedies that we have seen unfolding on the news these last few months in places like Ontario, in places like Quebec, where over 4,600 deaths took place in personal care homes once COVID-19 entered those long-term care facilities. Because of the steps that we took and because of the commitment of Manitobans to comply and in keeping our most vulnerable residents safe, Manitoba was one of the first provinces to actually begin, a few weeks ago now, starting to have outdoor visits at personal care homes, which restores that valuable need for residents to have physical and mental health. It gives them that connection back to their families. Virtual visits, video conferences, telephone calls, and window visits only go so far. And we know anecdotally and we know quantifiably that this has been well received by Manitobans. It takes some administration, it takes some doing, but we have been able to facilitate those visits and Manitobans are getting back to see those loved ones in person. But simply avoiding COVID-19 does not do enough to provide a resident in a personal care home with a sustainable lifestyle. Allowing personal care home residents to safely maintain the connections that they have with family and friends during COVID-19 is central to their well-being, central to their mental health. And that's why I am proud to announce that Manitoba will continue to ensure personal care homes remain safe and have residents connected. Starting today, the Manitoba government is beginning the work to develop outdoor all seasons shelters that will be located near personal care homes and be suitable for residents to safely visit with their loved ones. À partir d'aujourd'hui, le gouvernement de Manitoba entreprend des travaux pour développer des abris extérieurs toute saison qui seront situés près des foyers de soins personnels et qui conviendront aux résidents pour visiter leur famille. The Manitoba government is asking for feedback on conceptual designs for personal care home shelters to be built in the very near future. The shelters will be outside, but they will be close enough to the personal care home. They will operate year-round, and they will be accessible, protected from the elements, easily cleanable, and provide a space for a connection, for a quality engagement between a resident and a caregiver, a resident and a loved one. Manitobans can go to engagemb.ca to provide their feedback on what they think these shelters should include. Potential designs will be uploaded. All Manitobans will be able to have their say. Now, additionally, our government will be requesting proposals for safety and capital upgrades at personal care homes, and we are proud about that as well. Those proposals are intended to build on the government's commitment to ensure that health care facilities are in line with revised Manitoba Fire Code requirements. And those upgrades we're talking about include things like sprinkler protection, fire alarm, voice communication systems, carbon monoxide detection, emergency lighting, infection control measures, and residents' movement throughout the facility. These enhancements will better protect residents, staff, and the public. As mentioned previously, Manitoba was one of the first provinces to offer outdoor visits at personal care homes. As I said, that has been going well. It is limited, of course. It is easier to accommodate an outdoor visit in June or July than it is in November or February, so that's part of our thinking. But it is with that same careful and prudent approach that our government is developing plans right now to allow residents of personal care homes to resume indoor visits with their loved ones. So starting tomorrow, we will be shifting to allow indoor visits with residents of personal care homes as a next step. As I said, virtual visits and outdoor visits are good, but they only go so far. And as today demonstrates, the weather isn't always great in Manitoba in the summertime. So we're proud of this. We have engaged the operators of personal care homes. We have engaged with the regional health authorities. We have done a lot of things to get ready for this point. But we're taking this step because the evidence supports it. And I would be clear that this will probably be a limited kind of visit that we can offer. Dr. Brent Friesen, the Chief Provincial Public Health Officer, has made clear that Manitobans need to learn to live with COVID-19. We do not yet have a vaccine. There isn't a vaccine available on the horizon in the next number of months. And so we know that we'll very likely be re-entering a flu season in the fall where COVID-19 will continue to have an impact. So the decision we're making today to open indoor visits in personal care homes is based on evidence. But by the same token, our decision to curtail those visits in future will be based on evidence. If we see that the numbers are rising, we may curtail those right across the province, or we could take a more localized approach, a site-by-site approach. If we see something negative happening, we could suspend those visits there. Is there risk in doing this? There's some risk. We believe it is a calculated risk, but we believe it's a balanced risk, one that weighs the need to keep personal care home residents safe, but also takes into consideration what it is that Manitobans have been saying to us, and that is that they want to have that access to their loved ones, and they're prepared to take precautions to make that happen. Some of those precautions that will be in place when these visits start indoors, of course, will be things like there will be a check-in to make sure that you can answer questions that will give confidence to the operator that you haven't been in contact with someone with COVID-19 or you haven't traveled outside of the province. You will be required to wear a non-medical mask for the visit. That visit very well might take place not in the resident's room, but in a room where the operator of the personal care home has adequate space to facilitate that visit. There will be other precautions as well. And I can tell you that Lynette Saragusa will be expanding on the details of this new initiative later this afternoon when she does her weekly update. We know that this pandemic has caused everyone to make sacrifices, and our government has consistently tried to adapt and make plans to alleviate the stress that is being felt by Manitobans. We have been endeavoring to listen to Manitobans and to solicit advice from Manitobans. And as the Minister for Health, Seniors, and Active Living, part of that is obviously seniors, and I'm acutely aware of the specific sacrifices that residents of personal care homes and their loved ones have been making. I hope, and our government hopes, that today's announcement on both the creation of these outdoor semi-permanent shelters and the allowing of indoor visits for these summer months will ease the stress that I know a lot of people are feeling right now in Manitoba. Thank you very much. Merci beaucoup. I am happy to answer your questions at this time.
Thank you, Minister. Reporters are reminded they will have one question and one follow-up. We'll start questions today with Global and Brittany.
Good morning, Minister Friesen. Brittany from Global News. Will all care homes be ordered to build these structures? How many are we talking about, and what kind of cost?
So we have 127 personal care homes in the province of Manitoba, and yes, we will want to see these semi-permanent structures created at each of the personal care homes. Now, I will offer a caveat here. We are going to be flexible in this, and by the way, of course, our personal care home operators have been engaged in this already. Weeks ago already, we were planning for this, working with the regional health authorities, working with the operators, identifying someone in each region who would be responsible to carry this ball on this initiative. But we will also create the ability for the personal care home itself to be able to identify a possible secondary solution. Maybe there is an appropriate space in a personal care home that would meet the criteria that we are setting out without facilitating the transmission of the virus. And in those cases, if they can meet that criteria, there might be the possibility for the personal care home to create its own space indoors. Otherwise, this will be the fallback. Now, you asked how many we will need. Well, maybe we'll need more than 127 because, as you know, we have some very significantly sized personal care homes, and some of those may need more than one space to facilitate this. However, all of them would have some key components. They will have to be adjacent to personal care homes. You can't have residents outside for a long time. They will have to be wheelchair accessible. They will have to have very specific heating ventilation components. They will have to have surfaces that are easily cleanable. And there will be other component pieces as well.
Thank you. And do you have any idea right now on timeline and a cost for this?
We do. We have a very detailed timeline for implementation of all of this. I can tell you that very quickly now we're going to be turning on that community engagement to allow Manitobans to say, this is what I think should go into such a shelter. This is what I think should go into such a visitation shelter. And then we're going to be soliciting from industry for their ideas, for the specifications, for the design of this to say, what should this look like? And then after that point in time, we will be, of course, going out and having an RFP. We'll be awarding those RFP, that RFP, and we believe that these shelters should be in construction by the time August is here, because our window for delivery would be beginning of September and finishing at the end of September.
Thank you. From the Brandon Sun, Kyle.
Hello, Mr. I just wanted to clarify something. So are you saying with regards to indoor visits that starting today moving forward that people can visit their loved ones in personal care homes, or can they just start setting up those meetings?
So Lynette Saragusa will be providing more details this afternoon, but our plan is to commence these visits tomorrow. Personal care home operators are engaged. They have been advised, and they are all at work and have been at work to create the accommodation for these indoor visits. People should not expect this to be business as usual in a personal care home. There will clearly still be the need for hand washing, as I said, the use of non-medical masks, but we believe that these are conditions that Manitobans will be happy to comply with in order to facilitate those visits with their loved ones. I should also mention that these visits indoors won't be just for anyone. They will be for the designated caregivers of those residents of personal care homes. So it perhaps won't go as far as what some people would want to see, but again, it goes back to that need to balance the need for safety for this highly vulnerable population against that desire for Manitobans to have contact.
Thank you.
And from the Winnipeg Sun, Josh.
Good morning, Minister. This is Josh Aldridge with Winnipeg Sun. These outdoor shelters, is it going to be, are we looking at these being fairly large so multiple people can visit at the same time, or are they going to be more kind of individualistic and more permanent? I'm a little confused as to what the construction of these buildings or semi-permanent structures will be.
Well, I won't try to imprint too much on the activity because, as I said, we also want to solicit from Manitobans to see what they want to have. I would envision the ability for more than one visitor to be in that room with the resident. Obviously, there's going to have to be some kind of a porter, someone to facilitate moving that resident to the space and back out and monitoring them, of course. So there's going to be a need for there to be space adequate enough to accommodate a number of people in there. But I think that that's the kind of good advice we're going to get back from Manitobans when they come back with these ideas. I would want to point out we are really leading the way on this in Canada. We have obviously worked very well with other jurisdictions to know what others are doing. We see a gap here. We're trying to fill that gap of what visitations are going to look like. And for some who might think, why are we doing this at all? I would strongly suggest to those people, we should not anticipate somehow that we're going to be through COVID-19 and things are going to be back to normal by the fall and winter. We simply don't see that. Dr. Friesen has indicated that we shouldn't be planning for that, and now is the time to do this work and not when the fall happens. But the Netherlands in Europe has also developed plans and implemented plans for these kind of visitation shelters. And so we are looking globally to see what we can draw on for the creation of these spaces.
My follow-up is in regards to some more of the capital program. Talking with industry people a few weeks ago, we talked about the deficit for infrastructure and work that needs to be done with these facilities across the country. It's pretty substantive, and it's led to some of these issues that we are seeing in other provinces at personal care homes. You know the situation, how big the infrastructure debt and some of the work that needs to be done at these facilities in Manitoba? Is it pretty extreme, or is it just, in your view, just kind of fixing up things like smoke alarms, that type of thing, in terms of helping prevent the spread of COVID-19 or other pandemics that may come along in the future? What is the situation like with some of these PCHs here in Manitoba?
So I'll limit my response, of course, to healthcare. I'm not the infrastructure minister, but particularly to healthcare. Yes, we have inherited a deficit when it comes to the condition of our facilities. And we know as well, when we think back to the tragedy that happened in Montreal a few years ago, where residents of a personal care home passed away because there was insufficient fire suppression equipment involved. We have a deficit in Manitoba in the hundreds of millions of dollars just for fire suppression. And I would want to tell you that our government is proceeding. We are accelerating our timeline to go to market to award for looking after some of those things. So you're going to see a very aggressive strategy from this government already into the summer, being able to accelerate what was contemplated as a 10-year timeline, in some cases a 20-year timeline for the remedy of some of these inefficiencies and deficiencies. We'll be doing that much more quickly. Hundreds of millions of dollars, fire suppression, alarm systems, better accessibility, better lighting, and much, much more.
From CBC Radio Canada, Catherine.
Bonjour, Monsieur Minister Friesen. I'm just wondering, first of all, do you think that this will be creating jobs? And how many? Because there have certain management of these outdoor shelters.
Thank you for the question. Yes, I mean, the purpose is not in order to create jobs, but it will have the effect of also creating activity in our economy. We are very pleased in Manitoba the extent to which business and industry has stepped up to respond to COVID-19. We as a government solicited for participation by business and industry, and we said, how can you help? We created a portal for businesses and industries to be part of the problem solving we needed to do. And the result has been tremendous when it's come to scrubs and gowns and sanitation equipment. When it's come to visors and masks, Manitoba business has stepped up. And so we have every confidence that even with these outdoor shelters, we believe that Manitoba businesses will want to step up. They will say, hey, we have the knowledge, we have the expertise, we have the horsepower, we would like to be part of solving this problem. And so we're looking forward to that engagement with Manitoba business.
Soliciting the opinions and the reactions of Manitobans. There are many francophones in PCHs across the province. Will that solicitation and those forums be available in French as well?
Absolument, dans les deux langues officielles.
Merci. CBC Manitoba, Sean.
Good morning, Minister. I'm a little bit confused here. Tomorrow we're going to see a limited opening of accessibility to PCHs. You're also announcing these new facilities. Can you give me the? Is it so that these new outdoor facilities can accommodate more family and friends, or? I mean, I understand that this is going to go on a long time, but what is the driving force behind building the outdoor facilities? I'm not quite clear on that.
So the driving force behind this initiative would be that we're not going to be facilitating outdoor visits in December, January, and February. That's a limited time venture. We know that. As the weather got more suitable, we could allow the outdoor visits. They've been successful, and my thanks to the facility operators who really stepped up and worked hard to be able to accommodate these visits, and they're doing it. But also because we know that COVID-19 is something that we're going to need to live with for the next number of months. We don't have a vaccine yet, and so that means that what we are offering as of tomorrow in terms of that ability to have an in-facility visit may very well be on the basis of evidence going away again by the time we hit the flu season. Now, we will act on the basis of evidence, but we could be shutting those down. If we see transmission, if we see high flu numbers, then we're going to be shutting those down. So clearly, we have a number of things in the landscape. We have those virtual visits with video and telephone conferencing. We've had some window visitations, which aren't as good, but we've been able to facilitate some engagement and some interaction there between residents and their loved ones. We have these in-facility visits that we will be facilitating starting tomorrow, but we need something else, and we're not yet back to normal, and that's something else we think is that exterior structure, something outside that will be some form of shelter. Think of it as a semi-permanent solution that really gets people into a warmer space or a cooler space when it's hot and allows them to have that interaction with their loved ones.
So when you say semi-permanent, you're talking about as a fill gap measure until potentially we get back to normal, or semi-permanent in that won't be like a building.
So it will be some kind of a structure. You think about what schools provide when they have a portable classroom. Well, this wouldn't be as big as a portable classroom, but you should think that this will have a roof and walls and the ability to heat and ventilate, and they'll have doors. So that will be the kind of thinking that we're starting with. It needs to have controlled airflow. It will have to have wipeable surfaces. It's that kind of thing. But as you say, something that is not back to normal, but something that would facilitate a more robust structure in which a resident and their loved ones or their neighbors could have that kind of engagement. It will be something that then persists even beyond when we may have to curtail this interim permission we are going to give starting tomorrow for visits indoors.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Mr. Friesen, these indoor visits, you mentioned some of the limitations there, designated caregivers, there has to be a sizable room so that there can be physical distancing. Do you think that given those requirements, there will be a wide availability of this across the province?
Yes, we believe there will. As you say, Steve, there's been a lot of planning that has gone into this decision. Some people will say, well, why didn't you do this 4 weeks ago? Well, we've been following the numbers very closely. I know that Dr. Friesen and his staff have been following these numbers very closely. We know that we continue to have limited community transmission of the virus. So behind the scenes, there's been a lot of education going on for personal protective equipment. There has been the development of cleaning protocols. There's been a development of protocols that would facilitate the lockdown of facilities if they would see transmission. And then there's been the discussion about what would be necessary in terms of personal protective equipment. So non-medical PPE would be used as well. So we believe that now is the time for this kind of thing to be started. We anticipate that it will be available in some way, shape, or form at all facilities. And it's, again, going to take some creativity on the part of facility operators to be able to make this work. I would also add two other things. We are recommencing now, timed with this, the inspection of our personal care homes. As you know, all jurisdictions suspended their inspections of personal care homes because of COVID-19. Ours are restarting, and we have a robust plan to make sure that we're not doing less inspections, even as a consequence of having to pause them for some time. The other thing I'll mention today, which will come as a relief to a lot of people, is that haircuts will be starting again in personal care homes. This will be able to facilitate now having hairdressers in those facilities. And we know that's just been an annoyance to a lot of people. People want to get their haircut. Residents at personal care homes want to get their haircut. And that will start in earnest as well tomorrow.
And I'm wondering, as health minister, how you feel about Manitoba's numbers now, because the province has seen very low numbers, but recently there's been a slight uptick, and health officials reported one case where somebody with symptoms went to a retail outlet restaurant near Blumenort. So I'm wondering how you feel about these numbers, whether you feel Manitobans are generally taking the situation seriously.
Thanks for the question, Steve. It's a good question. Our numbers are good in Manitoba. They're some of the best numbers in all of North America. Certainly better than our neighbors to the south, certainly better than our neighbors to the east. And I think along with those low transmission numbers can come a sense of lethargy. You can relax your guard. Manitoba has been successful in its response to COVID-19 predominantly because Manitobans have done the right things. They have washed their hands, they have social distance, they have gone home, they've respected the rules that the public health officer has put out. Now, they need to continue to do that. And even though we don't have a demonstrated spread of the virus right now that is, where other jurisdictions are, we need to continue to do the right thing. The Premier has been clear. Our continued success depends on our willingness to continue to do the right things. I would also add the following. We've seen in other jurisdictions how quickly the situation can turn. We have seen how quickly a good news story can become a significant concern about spread. So people must stay home if they are sick. Manitobans, if you are experiencing symptoms, you owe it to yourself, you owe it to your families, and you owe it to all other Manitobans, especially those who are most vulnerable, to stay home.
From CTV, Mike.
Hi, good morning. I'm curious about these outdoor shelters. Who's going to be responsible for maintaining them? Will it be the care homes or will it be the province?
Thanks for the question, Mike. So as you can imagine, these would be built new this summer, delivered to site in the fall. So in terms of ongoing maintenance, there won't be any arising concerns because, of course, they're going to be built to a spec, and we would have confidence that they'll perform well. However, in terms of interior maintenance, yes, obviously there's going to be protocols there for infection prevention and control. And so there we are engaged with the personal care home operators. We would understand there could be some modest expense to maintaining these between visits, and we're engaged there to understand who should bear that expense and to what degree. But let us be clear, when we're talking about this solution, this is not something that we are foisting on personal care homes and saying, we will procure it and you will pay. Every Manitoban knows that our government has incurred a lot of expenses, and they are legitimate expenses to be able to do the right things for COVID-19, and this will be another COVID-19 expense that the government incurs.
And just as a follow-up, investing in shelters like specifically designed for COVID-19, it seems like it's fair to say the province expects COVID-19 to be part of our lives for quite a while. Since we're investing in something specifically designed for that, that's going to be there for quite a while afterwards.
Yeah, it's a good question. We thought about it as well. I would say, first of all, it can't be the center of our thinking. I mean, certainly we must all be good stewards of everything that we are procuring. And even on PPE, I am so proud of the way our healthcare system has responded. We had a team of people actually acquire tools in Manitoba for PPE that will go on being able to govern our inventory, to procure, to store, to deliver to site, and it will measure things like burn rate and variance. Those are incredible tools that will serve us right now during COVID-19, and they will serve us for years from now to be able to conserve and make best use of those materials. In the same way, I believe we're going to get some very creative things back from Manitobans. Don't underestimate the ability for Manitobans to be able to think about what we could use this for now and how it may be redeployed in future. I will add one thing, though. I think you're right to suggest that our thinking may change about how we facilitate visits in personal care homes. I think that some people, as I speak to the operators of personal care homes, and they anecdotally respond on what they're seeing, I think a lot of them suggest that there will be a more rigorous requirement in future, long-standing. If you come to a personal care home to visit 5 years from now and we're not in the middle of a global pandemic, you may be asked every single time you go there if you're feeling sick. You may be asked to wash your hands every single time. And I think that Manitobans may, in time, accept those things as being a necessary way to protect themselves and their loved ones. Certainly not curtailing the visit, but meeting a basic threshold. So who knows if in future we may be using these kind of shelters on a more exceptional basis to respond when we get a flu epidemic or something else. Time will tell, but for right now, your question's a good one, and we, of course, in all of our decisions are trying to be the best possible stewards of the money that we're spending, because in the end of the day, it's not our money, it's Manitobans' money.
City TV, Stephanie.
Mr. Friesen, you said that there would be
some risk in allowing visitors inside personal care homes starting tomorrow. I'm just wondering what you say to families who are nervous, who have loved ones in personal care homes about this new rule.
Yeah, I think it's true. There is some risk, and if I didn't suggest that today, I think you would call me on it, and you would be right to call me on it. But there's some risk in everything we do. My wife and I were at a restaurant on Saturday night, and there were incredible precautions being taken at the restaurant to keep everyone safe. Some people, our server told us, aren't ready to go back into a restaurant yet. So we know there's some risk in that. And our decision to go to a restaurant was a decision that was demonstrating some confidence. We were made to wash our hands and to sit at a distance from the next table, and we did it. I think in the same way, there is some risk in opening up personal care homes to in-facility visits, to indoor visits. But we believe it's a managed risk. It's a calculated risk. And we will have some people today who might suggest that we are going too far. And we might have some people today suggest that we are not going far enough. And I think probably there's some truth to being somewhere in the middle of that. So the important thing is it's not a reckless decision. Careful planning underway. Precautions will be taken. Operators are working hard to get this right. It will not be willy-nilly entrance into personal care homes. Personal protective equipment will be worn, hands will be washed, and distances will be respected. If we begin to see the results showing negative, we'll make decisions about curtailing this.
And then just to follow up, I know this will change as we go further along in the process, but how much has the province budgeted to build these possibly 127 outdoor shelters?
Well, and to be clear, it may not be 127. There could be more because of some of these larger personal care homes. There could be less depending on what personal care homes come back and suggest an indoor solution that would meet the guidelines that we are going to set out. However, to your question, I'd say I don't want to speculate today on cost. You can imagine we've sharpened our pencil and we've thought about a unitized price. But at this point in time, we don't want to influence the procurement exercise. So we've found in COVID-19, nothing is cheap. And certainly when we're attaching a timeline to things and we're contemplating a shortened procurement and construction process to build, then we're going to pay some premium for that. Nevertheless, we'll try to get the best value we can. And we'll have more to say, of course, when the tender is issued.
From the Winnipeg Free Press, Carol.
Good morning, Mr. Friesen. In keeping with the theme of learning to live with COVID-19, last week the federal government announced a COVID-19 notification app to help track the virus as more provinces reopen. Do you see any value in Manitoba getting on board with that soon?
Yeah, there's been a lot of discussions behind the scenes about some kind of an app, some kind of a digital platform whereby we could trade information that would help public health. Now, obviously, concerns arise because you're talking about privacy of individuals. I'm not a big fan of any kind of a GPS-based app. I don't think Manitobans are a big fan of that. I've seen some very creative speculation about a Bluetooth-based app that doesn't identify the owner of the device and does not track your whereabouts. It simply tracks when you've been near another device. Now, the limiting factors, of course, are uptake. I'm hearing that such a app really does not become usable from a public health point of view really until we reach the 60% zone. I don't know if we can get 60% of all Manitobans to load such an app onto their phones, and especially because our numbers remain low. I don't think Manitobans right now are seeing the urgency. However, what we've continued to tell the federal government is the federal government needs to lead in this area. If there even is speculation about this kind of an app, there needs to be one app. And right now we see as many as 4 or 5 apps being decided on across Canada. That won't be usable unless there's some way to trade the data because people are going to travel. So I think there's a lot of unknowns yet when it comes to the use of the app. We need to enhance public health ability to contact trace. On that, we are completely agreed. And I can tell you, behind the scenes, incredible planning is going into how to expand the ability of public health to be able to provide notification in the case they see a case of COVID-19.
Because one thing I'm hearing from a lot of people is that, provinces being open to travel more. You see an Ontario license plate and you wonder, I wonder if they're from Kenora or if they're from, Toronto or somewhere where there's a hot spot. What can you tell Manitobans about how to respond to that concern or that sort of feeling of, I hope, these people passing through or visiting aren't, infected?
Yeah. Well, I know Dr. Brent Rusin will be here behind the microphone in a few hours, and I think that if I was channeling Brent, he would say people should always use caution, and they should continue to use caution, even as we have moved effective yesterday to open the borders of BC, Alberta, Saskatchewan, and Northwest Ontario to lift the restriction on a 14-day isolation requirement. So now you can go back and forth, and we're saying to people, use your caution. Some people won't be ready to travel yet. Some people might think, my business there isn't urgent, so I won't go. I think we're going to see a lot of people traveling with precautions that they otherwise or previously wouldn't have made, like wearing a mask the entire time. But I think that when it comes to spotting those license plates in jurisdiction, we want people to be vigilant. We hear the evidence as well of people saying, we saw a license plate from Ontario at Costco or Sobeys, and we're wondering if they should even be here. Well, I mean, we're all Manitobans, and our license plates read Friendly Manitoba. And so I think we can still be friendly. We can be prudent. We can be good. We can be good neighbors and friends to others while we still seek to keep each other safe.
Thank you, Minister. This concludes today's media briefing.
Thank you, everyone.